having some fun, actually working, kind of both. And
Both.
we're back today to talk a little bit about the Mental Health Awareness Month, in particular, how mental health is seen, affected, and really managed by a specific community, being the Hispanic community. But first off, welcome back, Dr. Patino. How you doing?
Thank you, Vince. It's great to be back. I miss being here. I miss having these conversations, and I think that we landed with restarting the program again in May, which is a Mental Health Awareness Month every year,
Mhm.
which we hope it would help us reduce stigma, right? Even though we say that every year and the stigma continues. So we need to do a better job of getting real about people recognizing that mental issues are not mental, they are medical. And that our brain, actually, we're realizing now more recently, our brain manages everything. Our gut, our heart, our lungs, our legs, our ability to walk, see, hear, respond, react, everything is in the brain. So if mental illness is in the brain, mental illness is into everything and affects everything. So we have to help people understand and introduce mental health into their well-being, into general health.
It's interesting you said that because there's a section in one of the classes I teach in my other world. They talk about you would be restricted from certain things if you were mentally ill, adjudicated incompetent, or forcibly institutionalized. And I always have to pause and say, look, folks, if we go back here and just say mental illness and we tested everybody in the room, I guarantee quite a few of you would have something pop up. And it's not so much, and I say, and I try to get to understand this is just as common as something like high blood pressure or some type of heart disease or diabetes, and I think that's part of the issue. If and I think you might agree, is that people still think this is a rarity as opposed to something quite common.
Well, yes, I mean, and I know you know that I do forensics and I do a lot of forensics in psychiatry. And people need to understand that when we talk about mental health in the legal context, it's very difficult and different than talking about mental health in the clinical setting, right? Because the law looks at mental health very different. I mean, issues of competency and your ability to exercise objective judgment and your ability to make decisions is very different than what we measure in clinical ways. So, yes, we as psychiatrists have one of the powers that is reserved to very few people in this country, in the United States, and is that the ability to restrict your liberty.
Mm.
But it's a very well controlled process, meaning you have to be a danger to yourself, you have to be a danger to others. In Arizona, you can be committed if your mental illness is so severe that you're likely to become dangerous. So we have to separate those in terms of the legalities and the clinical. But also, I think it's important that people realize that mental illness is probably more frequent than a lot of other medical disorders, right? So, for example, when it comes to disability, depression is a number two or number three, goes back and forth, cause of disability in the world.
Mm.
You're more likely to be disabled because you're depressed than because you had a motorcycle accident, right? And you broke your leg. Because the disability caused by mental illness is usually long lived, is a chronic disability. So, uh, and a lot of people die from this. What we know also is that mental illness itself is a catalyst for longevity, meaning people who have chronic mental illness don't live as long as people without mental illness. So we have to go back again and realize this is part of health. Let's avoid the dichotomy of body and mind, right? I mean, that is an artificial separation that we've been dealing with for centuries, right? The mind, and then we get the mind closer to the soul, and the body close to biology. They're the same thing.
Mm.
Okay.
You mentioned that the brain controls everything, and as you said, people tend to look at and quite frankly manage. personal physical health very easily. If someone's diabetic, oh, you're diabetic, great, you just do this. But the mental health side, when someone says, hey, I'm bipolar, or I have some type of OCD, that's treated very differently. Why it's such a stigma?
Well, there's a stigma of those being issues related to emotions.
Mm,
Those are issues related to behavior. So anything that has to do with behavior, emotions, decision making, we tend to put into the mind and not into the body, right? So we know now, and we've known for the last 20 years, and we're learning every day that the connection between your brain and your body is a two-way street. So the health of your gut and your heart and your lungs and your muscles affects your brain. The health of your brain affects your body. Actually, there's some very interesting findings most recently with Alzheimer's in terms of the relation between Alzheimer's and your gut, the
hmm.
health of your gut, microbes in your body that may have an impact on chronic inflammation and how chronic inflammation may be a catalyst for cognitive impairment. So it's really fascinating to look at how our brain and our body are not as separated as we want to think.
So hopefully one day we won't have a mental health awareness month. We'll just have a simply a health awareness month that would cover all bases.
Yes, and again, I'm biased on this because I work with the brain and I work with behavior. But my bias is that we need to stop using terms that make this like voodoo, like magical, like spiritual. This is this is action reaction processes, even though we don't understand them all, that we have to keep in mind that every time that you feel something, a biochemical reaction is happening in your brain. Whether it's love or pain or sadness, a chemical reaction and a connection of centers in your brain is happening.
And it happens for everything, everything we input, everything we do, correct?
Well, let me put it this way: you standing without moving requires so much activity of your brain to do things like keep you balanced.
Hmm.
I mean, your eyes, your ears, your proprioception in terms of your ability to the sensors in your legs and in your back to tell the brain, I'm not falling forward, I'm not falling backwards. I mean, think about a computer that will have to do that, right? You having all these signals going to your brain is processing a microsecond. That's why in biology of the brain, we always say that perception is always in the past. Because by the moment that you become aware, your brain already processed that.
Hmm.
And it processes not only things that are real, it processes things that are sensory. Like, why is this person so close to me? Right?
Interesting.
So there's
I,
a lot of stuff that goes on there.
I think when people have to kind of put it in a little more perspective, if you've been part of science fiction or fantasy or movies all these years, the whole thing of the robot, and the reality is to make a robot that can do even things that relatively close to a human can do is incredibly difficult. We're not there yet.
Oh, absolutely not. Because um, we have a, think of it as a series of great computers inside of a small 2 pounder, right? That is a big ball of fat with cables in it. And all of these computers are in there. And not only they're communicating with each other, they can repair each other.
Mm.
They can grow new connections based on your experiences. So as we develop new experiences, the brain connects differently. So it's really fascinating. So I hear a lot about fears, nowadays that we're getting into artificial intelligence. And well, we need to define intelligence first, right? We need to get closer to the definition of consciousness and what it means. Uh, but I remember hearing these same discussions when the internet started, right? It was going to be the end of the world. Now the internet is going to do all these things, and we're going to have zombie robots coming to eat us and stuff like that. So it hasn't happened yet. And again, maybe I'm over optimistic, but I'm very uh, encouraged by humanity's ability to stay alive.
Well, Schumpeter's innovation curve always comes into play, where we always find something else to do. Um, so, Mental Health Awareness Month, and we have chatted about this before because your background, where you're from, but specifically for the Hispanic community, there seems to be a significant challenge in getting acceptance, really, of even the concept of mental health. Why is that so?
Well, one of the things that has been very popular over the years, over the last 25 years, and even when I was in training back in the 80s, early 90s, is the idea of cultural awareness, right? But we introduce cultural awareness as we look at a museum, right? We're fascinated by the culture without understanding the cultural awareness is a two-way street that requires you embedding yourself into the understanding of that culture, right? So if you want to understand the why, okay, people from Hispanic backgrounds tend to have some resistance to this, is because number one, they haven't been exposed to it. So there's newness to it. Level of education, academic levels have to do with that. Uh, there's not a lot of education about mental health issues like depression, anxiety, alcoholism, uh, sexual abuse, incest. All of those things are voodoo in the Hispanic communities. So, and I think that there are religious undertones to that, you know. Uh, then you get into language, and you get into issues of the Hispanic individual having been born here or not, you know. Do they speak the language? Do they don't speak the language? So all of that leads to a high degree of distrust, right? Um, Now you also need to understand that, and you will recognize this. Most of the people of Hispanic background is migrated to the United States after the 1960s are coming here to work in the farms, and a lot of these people, some of these people don't speak Spanish. Some
Hmm.
of these people come from South Central Mexico, Oaxaca, Chiapas, areas where they use their dialect. So there's a lot of nativism in terms of Native American, Native Mexican people who haven't been acculturated into the middle class. So there are socioeconomic issues, right? What is the degree of education? They hardly speak Spanish. They speak their language among themselves. And then they come here and somebody goes into a psychosis. That becomes a difficult thing for them to handle because it becomes a very difficult issue culturally speaking. So then you go into the traditional cultural issues that you can read in old psychiatric group books like the shaman and and the curandero and things of that sort. So there's still a lot of that in the Hispanic community. Now, if you go back to the Dominican Republic, you go to Argentina, you go to Mexico, Colombia, and you go into the middle class, highly educated people, the acceptance is no different than the United States.
Oh,
So,
interesting.
so we need to understand that there are differences in terms of acceptance. Um, the second part is that a lot of the people who recently migrated to the United States don't have the time to think about these things because they have to survive.
Too busy working.
Yeah, so when you're in survival mode, you're not going to be saying, well, am I depressed or not? The question they're asking is, am I going to eat today? Do I have a roof over my head for me and my kids? So, in order to facilitate learning, we need to educate people very early. And we've discussed this before um, in terms of first generation born kids from migrant people, right? Whether they came from Central America, Mexico, South America, or even Europe, or people from the Middle East, right? Or people from Ukraine, where they bring their culture and their values and they have an expectation that their kids are going to have the same. And it becomes really shocking for them to realize that the environment and the fact that the kids learn English before their parents creates a significant issue.
Hmm. So, cultural isolation, linguistic isolation, um, but on a more universal level, as being that it is again Mental Health Awareness Month, what advice would you have? to, quite frankly, everybody concerning mental health and how we can take this next month to maybe move things forward a little bit.
Well, we need to engage. We need to engage not only at the level of the individuals, we need to engage leadership. We need to engage uh, people who are interested on and empathic to stopping the suffering of people from these disorders to be more prone to approach, right? We always look at the Hispanic community um, as being monolithic, right? It is the Hispanic community.
It
No,
is
you have
not.
it
Yeah.
is not. You have to understand where they came from, how long they've been here. There's people in a lot of people in New Mexico, Arizona, California, um Texas, in particular, in all of these border states, that they're Hispanic, but they've been here before Americans got here.
hmm back when it was back when it was Mexico, right?
Correct. So those people are a lot more acculturated, even though they maintain their culture and their roots. Their participation is very different. So if you talk to somebody who's been here for 400 years in their family, and you talk to them about migrant workers, they may have a very different perception than somebody who got here 3 months ago, right? So we need to be able to approach this in a culturally sensitive way that is not monolithic, that recognizes the experience of each individual. And we have to be open to listen to that, right? Let me give you an example. When I was a director of emergency psychiatry here in Maricopa County, and I had students working with me, I used to tell them, listen, if you get a Hispanic family and a patient with a crisis, danger to self, danger to others, suicidal behavior that we're trying to help, there's going to be a lot of family in the waiting room, right? And you need to identify who's in charge. And it's not the person who's yelling and screaming. It's not the person who's making the most noise. There's probably an elder lady in the back room, sitting quietly saying nothing. You want to talk to her and you have to talk to her with respect and with understanding that this is a difficult cultural issue for them, right? Because you have to connect and recognize who are the people who can provide you the movie, right? I mean, because a lot of people in that particular situation will be working on, I want to get my brother out of here, he doesn't need to be here. I don't know why the police got involved, you know. But that person is not directing the culture of that environment. So you have to be sensitive enough to recognize, and that requires patience. And one of the things that we've lost over the last years is two things. We've lost the ability to educate children, and we lost the ability to be patient.
Two very important things for society, of course. What other advice would you have for just the population in general concerning mental health, whether it's for themselves, a loved one, or really just better understanding how mental health fits into our paradigm of life here in the United States?
Well, you see, we have to go to where the patients are, and we have to go to their communities. If you set up a center in a place that is not accessible, available, and affordable, people won't go, right? So something that we have to take advantage of is that the Hispanic population is very respectful of the physician,
Mm.
right? So if somebody comes to me and tells me, where would you place a mental health center, I will say in the family doctor's office, in the pediatrician's office. I wouldn't call it a mental health center, you know. I will just have mental health professionals there to work with the individual. This is particularly important because the connection between mental health and the patient is a lot easier if you have the resources where the patients are willing to go. Right? If you call it mental health center, and you expect people to walk into it, they're not going to walk into it, right? But if you said family medicine, pediatric services, or you have it in Spanish, the patient will go there.
Mm.
And if the physician or the social worker or the nurse identifies the patient having some psychiatric issues, they can tell the patient, we have somebody that can help you with this, let me get another doctor to talk to you, blah, blah, blah. Because what happens with people, they're suffering from mental health problems is that they don't trust anybody. So now the other place where you can actually gain a lot of uh, support is through religion. And it's going to be weird for me to be saying this because I'm not somebody who's terribly religious, even though faith I think is important in terms of recovery, especially for the Hispanic population. But places of faith are also opportunities for engagement.
Mm.
Okay. So we have to maybe start doing some uh, call for action, start talking to leaders, going to the churches, do a lecture about in their language about what depression is all about, what suicide in adolescence is all about, what's going on with fentanyl, what things that they can do, so they don't feel victimized by the system, they don't feel victimized by the illness, and help them feel empowered that there's some things that I do control, right?
Sounds like a lot of trust has to be built.
Absolutely.
Okay. Well, thank you, Doctor, once again. Please, everybody, let us know what you'd like to hear more about. Since it is Mental Health Awareness Month, we can pick a topic a week for the month and help you out. Please remember to like, subscribe, and of course, that little QR code up there for Dr. Patino's latest book. And we'll see you all again next week.
Thank you.